Thank you. My name is Joshua Lynch. I'm an emergency physician, EMS medical director, and the founder of the New York Matters program from Buffalo, New York. Prior to the development of the New York Matters program, the care of patients with opiate use disorder in emergency departments left much to be desired. Patients were often discharged with a list of phone numbers of overwhelmed treatment clinics. Some of these numbers were not even active, and appointments were weeks away. In 2018, we sought to eliminate these barriers and develop Buffalo Matters, a referral network in Western New York to facilitate access to care for patients with opiate use disorder. Today, the program has expanded to several regions across the state and has rebranded to New York Matters. The program offers referrals to treatment through a completely electronic referral process securely housed on the DOH, New York State DOH Health Commerce System. We currently have about 20% of the New York State hospitals participating. With hundreds of weekly appointments available, most patients select an appointment close to home and are seen within 1 to 2 days. All patients are offered the same appointment opportunities regardless of past drug use, insurance status, and current substance use behavior. The Warm Handoff Bill, S4359, aligns policy with best practice to better serve individuals with documented substance abuse. New York Matters exemplifies the different components of the proposed bill in that it calls for harm reduction techniques, individual and community-based treatment options, immediate treatment of withdrawal symptoms, and facilitates a streamlined outpatient referral process that can be completed in minutes. New York Matters also has resources embedded into the referral process to cover medication and transportation costs. Uninsured patients are automatically issued a voucher to cover 14 days of buprenorphine or Suboxone, and any patient in need of transportation assistance can be set up with a round-trip Uber Health ride. No questions asked, no waiting periods. New York Matters further aligns with the Warm Handoff Bill in that it supports both patients and providers. The program offers an integrated, suggested protocol for treating patients with opiate use disorder for clinicians that might not be as comfortable. It highlights the importance of immediate buprenorphine initiation in the emergency departments. New York Matters is also accessible to patients virtually. 2 virtual emergency departments have been set up in Western New York, and patients across the state can schedule appointments to be evaluated virtually by an emergency provider that can prescribe buprenorphine, also for many other issues, including general health conditions that they can't go to the hospital. Many of our New York Matters clinic partners continue to offer telemedicine options as well. New York Matters offers a seamless and innovative approach to addressing the needs of patients with opiate use disorder. Our program has demonstrated real-world application and success, which is shown in our 3 years of data collection and analysis. New York Matters is poised to expand across New York State and serve as a key asset in implementing the Warm Handoff Bill that clearly sets out to help both patients and providers. Thank you for your continued service to New York State. The New York Matters team is ready to go today to help implement the Warm Handoff Bill, S4359. The passage of this bill will certainly save countless lives across the state. Thank you.
Thank you, sir. Senator Harkin.
Thank you very much. Thank you, all 3 of you, for excellent testimony. I have a couple of questions for different members. Dr. Lynch, you talk about, this is intriguing and something I haven't heard of before, a virtual emergency room. Take us through that. How does that work?
Yes, sir. So it's exactly what you would think, although it's not that intuitive when you really start to think about it. So in March, just after St. Patrick's Day of last year, we realized very quickly that there were a lot of unknowns, and we thought that patients might put off getting health care by not coming to the hospital for fear of the hospital being covered in COVID, and at times it was. So we built 2 ways to access emergency providers from patients' homes, and we can treat minor things. We can also answer questions. We can put COVID fears to bed. If you remember back in the spring of last year, many questions revolved around, should I get tested? How do I get tested? What do I do? But we also realized very quickly, and now it's a harsh reality, that patients with opiate use disorder were using alone and staying at home and not getting any care. So that wasn't the original intention, but our mission quickly changed to providing access to medication-assisted treatment virtually and offer patients with opiate use disorder quick referrals without them ever leaving their home.
And how do people access? Is it a web-based?
Yep, you can go to the website. You can go to New York.
And what is your website? Just since we're in a public forum.
NewYorkMatters.org. You're able to access many resources for patients, but access to the virtual emergency departments are on that link as well.
All right, thank you.
You're welcome.
And to Stephanie, I have a question for you. Thank you for your testimony and your work as well. You have done a lot of work with Westchester County Commissioner Orth on integrated care, and at really beginning that rollout of that model. Can you take us through specifically some of the things that Westchester is doing to implement this integrated model of care?
Absolutely. So originally, I was elected to the Regional Planning Consortium for New York State. It was designed for Medicaid redesign and integration. I became the youth advocate for that group, and I started talking co-occurring everywhere all the time. Commissioner Orth supported everything that I did, and then it moved into our entire region. I became sort of the leader of the co-occurring effort, and then in Westchester County, we created a co-occurring system of care committee. So it's a combination of hospitals, agencies, providers, families, peers, youth, really looking at from prevention all the way to sustainable recovery, how co-occurring matters. How do we embed within our providers the ability to integrate even without OMH and OASIS supporting? So it's like you're listing something as primary, we're encouraging you to write in the narrative what else is going on, and we're really starting to do things. Then we started to get funding. We got funded from Montefiore, we got funded from WMC Health to start looking at how to bring in integrated evidence-based treatment. So that's Encompass, developed by Paula Riggs out of the University of Colorado. We've now infused Encompass in 6 of our providers in the county. We've now started working with our Opportunity Youth Park courts. So when you think about young people who might be in an inpatient situation and you're thinking they need an intensive outpatient, Encompass is once-a-week therapy. When my son came out of the first rehab program, I was taking him to the 12-step meeting, the IOP, the psychologist, the psychiatrist, the gym, and he had a recurrence in use in under 2 weeks. We have very complicated young people who are sustaining recovery or, harm reduction in use successfully. Then you've got the prevention work. So now we have our school districts, our colleges. I'm now working with the New York City Police Foundation, so I'm in the Bronx doing co-occurring disorders awareness. Mental health matters. Why? Because when our young people don't take care of their mental health, they navigate to things like substances. And so empowering them to be part of the solution, to really understand this relationship, it is the first of a kind that we've branded and logoed, awareness games, everybody is talking about it. So what started as a mission born by tragedy has become something that has been unfunded, but everybody is so committed to the process. And we go around the state. I've been in Rensselaer, Schenectady. Everybody wants to be able to do it, but you really can't do the lift unless the state creates a way to do this. So that's really what we're focused on, and that's why your bill, when we met, Senator Harcum, and you started talking co-occurring, it was amazing. And for me, my state senator is Andrea Stewart-Cousins, and she can talk about co-occurring. And Senator Burke, I'm looking forward to meeting with you because we don't know each other yet, but this is the best way. We talk about we talk about a lot, medication for opioid use disorder. What will cause people to have a recurrence is their mental health, their trauma. And so if you don't support that as part of an integrated solution, you are missing the whole point.
Thank you.
I hope I answered that.
Yeah, thank you. I think I'm out of time, but
Sorry.
thank you as well for your testimony.
Senator Gallivan.
Thank you. So New York Matters, how does an individual find out about it and know that this exists?
Yeah. So there are multiple ways for someone to get referred through the New York Matters program into our wide variety of outpatient treatment resources. One can be through the emergency department, also through primary care offices, the scenes of particular EMS calls. Some police departments have participated already, and also they can be referred through the virtual emergency department. So our goal is to meet patients where they're accessing care already, or meet them at home through virtual means.
So you provided us some information, and there's a map, a statewide map of your various partners. And I did want to ask you about your law enforcement partners, because I could see that something being very valuable. Often they're the first ones that are responding to incidents regarding overdoses or whatever might take place. So can you describe your partnership with the various law enforcement agencies?
Yep, absolutely, thank you. So our partnerships with law enforcement looks a little bit different depending on the situation that we're in. So the initial goal was to provide referral options for individuals that found themselves at the police station. So either coming to drop off unused drugs, which in some cases you can do, or after being arrested. So our partner law enforcement agencies that work in that way, when someone is going through the police station getting processed, they can be offered a referral right from there. In some cases, they're offered a virtual emergency department visit with an emergency provider to address the medical needs, literally while they're sitting in the police station. And they can leave there, instead of going to jail, they can leave there with a referral appointment tomorrow, an Uber Health voucher to get a ride to their appointment, and perhaps a prescription voucher to cover their first 2 weeks of medication. Much different than past experiences. And another way to look at law enforcement partnership is on the scenes of 911 police calls. We are now equipping police departments to be able to offer that virtual assessment and referral right from the patient's living, or the individual's living room, the side of the road, the back of a police car. So we're truly meeting patients where they are.
And I see the value in that. Because my question would be, do you have plans to, or is it possible to expand across the state to equip, at a minimum, all first responders with this information?
Yeah, our project was built from day one to make this scalable to the largest urban area to the most secluded rural area. And we've done that with hospitals, we've done that with clinics, and our plan is to do that with law enforcement, prisons, jails, and EMS.
Okay, thank you.
Thank you.
Thank you, Senator. Senator May.
Yeah, thank you. This question is for Dr. Lynch. I was struck by your comment about anyone could be set up with a round trip. Is it not up? Thought it was, sorry. That, about the Uber Health Ride option for people. And looking at the map, there are giant areas of the state where there are not referral sites. Is there a limit to the range of those? And I also just wanted to say, I have a bill we're hoping the governor will sign, that's about beefing up the non-emergency medical transportation system in our rural areas. And one of the problems with that system is that it's been undercut by taxi and Uber kinds of modes of transportation. So I'm just wondering what you can say about how that works, how that gets paid for,
Sure.
what the range is, and what the alternatives are.
So the New York Matters we're very appreciative of being able to receive funds from the county, state, and federal level. And those are applied kind of across the resources that we give to our patients. In regards to expanding across the state, our goal from day one was to make all these resources available everywhere in the state. We're on track to do that. I think 20% of the hospitals is just one step in the process. Bringing on police departments is another, bringing on EMS agencies is another, and actually we just launched the transportation voucher within the last month. So Uber Health was just the first one. Lyft, other companies, if you're out there, we'd love to partner too. We understand that Uber's not everywhere, and there are certainly other independently owned regional organizations that provide transportation assistance. We have partnered with not only individual, independent, family-owned pharmacies, but we've also partnered with CVS, Walgreens, and Wegmans to accept our vouchers. So we expect the same trajectory to happen with our transportation voucher assistance program also.
Okay, well,
Thank you.
I will put in a plug for Senate Bill 1509 because it really does, it's aimed at the rural non-emergency medical transportation.
Thank you.
But thank you very much.
Thank you, Senator. Senator Hinchey.
Thank you very much. You'll probably see a theme in some of my questions for a couple panels, but for Dr. Lynch, can you talk a little bit about the reimbursement rates that you're seeing and how you're able to kind of provide all of these services from an economic model? Because again, in communities that I represent, we are seeing them decline. Your model is incredible, and we're seeing a lot of those services decline specifically because of reimbursement rates. So curious how you're able to do that and what that looks like for you.
Right, so if you recall from my testimony, we provide the same opportunities for patients regardless of insurance status. Sometimes that's a hard sell, going to a clinic organization and saying, hey, you can't discriminate on insurance status when patients are being sent here. And in most cases, the work of our outpatient treatment organization partners has been incredible. They will go out and seek grant funding to provide a nurse practitioner that can provide coverage to that section of the patients that we're referring without having to bill. That has been a huge one. Reimbursement for certain payers really is prohibitive in some areas of the state to have organizations partner with us. we really go on the principle that patients need to be offered the services regardless, of their insurance status. So continuing to support outpatient treatment organizations in better reimbursement or even more appropriate reimbursement for the services they're providing would be much appreciated. Thanks.